Hey, Dr. 𝗀𝗀𝘀 𝗖𝒂𝒓 from Mission Health Center. Welcome back. Today we're talking about lumbar decompression. It's one of the techniques we use to help when someone has a spinal misalignment called a subluxation, as well as have their disc become involved. And ultimately, when either one of those happen, it can lead to pain. That pain can not only stay in your lower back, but it can also radiate down into the legs, down into the toes or into the feet. So this is a natural way to start to reduce that pressure on the disc, allow the body to heal, and ultimately get you back into proper alignment. So I want to take a couple minutes today and explain how this process works and ultimately what it does for your spine. The first thing is a little review. If you recall, we talked about the spine having curves in it. So we've got a curve in our lower back, a curve in our middle back, and a curve up here in the neck. Today we're going to focus our attention down here on the lower back, and I've got a drawing that I'll pull up, and when we look at this, we've got spaces between each of these bones called the discs. And so when you think of the disc, here's that fun little spine. I'm an artist, so you see the curve there, there, and there. So when we look at the lower back, we've got the spinal bones are the blue boxes there, and between each of those spinal bones is the disc. And the disc is what, again, works like a shock absorber, like a cushion between the bones to allow those bones to have separation. And each one of them are designed to be the same distance apart. They're all designed to be about the same size. Now, one of the things that we look at is that when we have an injury or we have a spinal bone that shifts out of proper alignment and it compresses on that disc, it can force this disc here to swell. So all of a sudden we see a disc that becomes bulged, or it swells a little bit, or becomes a hot disc. And as a result, when that happens like that, the nerve that runs right down the back of the spine here gets shifted and pushed out of the way. That right there is ouch, that hurts. Now, one of the big things is that when that disc gets compressed or it gets pressed on, we have to shift the spine out of that abnormal position, get pressure off the disc. And one of the best ways of doing that is by the use of a lumbar or a spinal decompression table. Now, when we look at this table here, this table is designed to slowly and carefully open and close. And what that does is it very easily and very carefully helps to pump the lower back in a controlled manner. And by opening and closing the spine will ultimately allow that bulge or that protrusion or even that herniation to begin to be able to heal. And so as we create this negative pressure on the disc, it allows oxygen, water, as well as nutrients to go in and help that disc heal. One of our treatments in the office in order to help a disc is by using this table called the lumbar decompression table. And then right after doing decompression, we will always perform a very specific, very pinpointed chiropractic adjustment to help your back to heal the best it possibly can. If you have any questions about lumbar decompression, feel free to reach out to us. I'm Dr. 𝗀𝗀𝘀 from Mission Health Center.